So any clicking sensation around the hip or the popping sensation around the hip is not of a concern most of the times, because most of the times it is pain-free. If it is a painful clicking sensation, then it needs to be evaluated. So for example, in younger individuals, it could be mainly because of ligaments or tendons causing the problem, either outside the hip joint or which are crossing the hip joint inside, which are referred to as snapping hip, either internal snapping or external snapping. In older individuals, it could be arthritis which is causing the problem. In an active sporting individual, it could be because of the trauma or injury to the structure around the hip called labrum. Or in some individuals, it could be because of a condition called impingement because of the anatomical differences within the hip joint. So when an individual comes to us with clicking sensation, so we evaluate them according to the age. And the first basic investigation we get is X-ray of the hip, and we look for the anatomical variations in the hip joint, number one, and if there is any wear and tear in the joint or arthritis, especially in an elderly. In younger individuals, most of the time it is normal, and in which case the gold standard investigation is going to be an MRI scan, which will tell us what is happening to the labrum of the hip joint and the structures around the hip joint. Most of the time in younger individuals, it will be the ligaments around the hip joint. One of the commonest tendon or the muscle is called iliotibial band, which snaps around the most prominent bone around the hip joint called the greater trochanter, which snaps on it and causes this snapping. So all this will be clinically evaluated and investigated with X-ray and MRI scan, and accordingly treatment is offered. Most of the time the treatment involves physical therapy or physiotherapy, and if any obvious injuries have happened around the hip joint, very rarely surgical intervention will be required.